Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name? Nice to meet you, Mr. David. May I know what brings you here today? All right. And tell me more. I'm very sorry to hear about your uncle's death, Mr. David, and I appreciate that you are concerned about your health and you came here clinic at my clinic for quitting smoking. Okay. But Mr. David, before I come to the management part, I'll ask you a few questions to better understand your condition. Okay, and to help you to quit smoking, if it makes sense to you. Thanks for your cooperation, Mr. David. Since how long you have been using cigarettes? You are smoking. Okay, and how many cigarettes per day? Okay, Mr. David, have you ever tried to stop smoking in past? Okay, Mr. David, besides that, do you drink alcohol? Using any recreational drugs also? Okay, and what caused you to quit smoking in past? Okay, Mr. David, and does anybody else in your family also smokes? Do you have any medical problem? High blood pressure? High blood sugar? If you are taking any medication for arrhythmias, suffering from epilepsy, liver cirrhosis, do you have any eating disorder, Mr. David? Okay, Mr. David, if you were admitted in hospital before due to a stroke and TIA, which kind of weather do you like the most? And how about your mood, Mr. David? And how about your sleep pattern? Okay, Mr. David, if you are taking any medication prescribed by a doctor or over the counter? Okay. All right, Mr. David. If you are married, and do you have kids? Okay. What do you do for a living? All right, Mr. David. Mr. David, do you know hazards of smoking and benefits of quitting? May I offer you a few hazards of smoking and a few benefits so that you can stuck to your decision? Okay, Mr. David. So let's talk about the hazards of smoking first. Smoking causes heart-related problems like a heart attack and can cause paralysis and breathing problems like asthma, COPD, okay, and it can also cause blindness, impotence, and infertility. And it can also cause skin wrinkles, stomach cancer, and it can cause certain cancers of mouth, lungs, bladder, and blood cancer as well. If it makes sense to you, Mr. David. Okay. Shall I proceed to benefits of stop smoking? Okay, so Mr. David, 1 month after quitting, your skin will be clearer, brighter, and more hydrated. Okay, and 3 months after quitting, you will not have cough and wheezing, and your lung function will improve by 10%. Okay. And by 1 year, your risk of heart attack will be half, and by 10 years, your risk of lung cancer will reduce to half. Okay, and you'll no longer harm others by passive smoking, like particularly to your children, your spouse, your close ones, and there will be no asthma, no ear infection, and no infant death as well. Okay, Mr. David, so do you understand? So can I proceed with craving of cigarette after quitting? Okay, so Mr. David, do you know you can have craving for smoking after cessation? So you can become restless, irritable, and there are some symptoms of low mood as well. Okay, so let me tell you that you can have craving. Okay, but you can decrease it by distracting yourself by doing some gardening or reading books or watching TV or doing any thing which makes you happy, anything from your hobbies. Okay, and I'll encourage you to drink plenty of water. Okay, and I'll encourage you to discover your friends and support groups and to know how they deal with their craving. Okay, Mr. David. Yes, Mr. David, it is my considered opinion that the longer you smoke, the more damage it does. So the sooner you stop, the better. Okay. Yes, Mr. David, it's never too late to stop, and your health will start improving from the moment you quit. Okay. And besides that, giving up tobacco will make you healthier and fitter and save your money as well. So if it makes sense to you, Mr. David. Yes, Mr. David, I can help you in quitting smoking, and I may enroll your family members, friends, or colleagues at work, and that will also help. And I'll offer to refer you to stop a smoking clinic. Okay, and I can help you set a quiet diet. Okay. So that you can stick to it, and you should stop smoking and be quiet diet, and not even one puff after that. So you have to decide the date when you are going to stop the smoking. Okay, and after that, first of all, we'll have to understand the nicotine in the cigarette. Okay, which is highly addictive, and after stopping smoking, a person can have craving for smoking due to nicotine addiction and nicotine replacement therapy. Okay, replaces nicotine, but the tar and gas of cigarettes are eliminated. Which are very injurious to health. Okay, Mr. David. Yes, Mr. David. So nicotine replacement therapy is available in the form of patches, gums, tablets, and lozenge. Okay, and nasal spray and inhaler, and you can take NRT in which from you want to take. It's up to you. Okay. And I'll offer nicotine replacement therapy for 2 weeks. After 2 weeks, if you demonstrated and continued commitment to stop smoking, I'll prescribe a further 1 month. Okay. If it makes sense to you, Mr. David. Yes, Mr. David, before starting the manual, let me inform you that treatments are available in the following form, like NRT, nicotine replacement therapy, tablets like bupropion, acupuncture, electronic cigarettes, and alternative therapies like homeotherapy and hypnotherapy. Okay, Mr. David? All right. Yes, Mr. David, bupropion is contraindicated in breastfeeding and those having eating disorder, epileptic fit, and cirrhosis. Okay, so it's not good for you. Okay, as you stated that you have liver cirrhosis as well. Okay, Mr. David. Yes, Mr. David. So, is there anything else you want to discuss with me today? Okay, Mr. David. So, I'll follow up your progress and offer you a second appointment free. Okay. And here is a leaflet. It includes all the information regarding quitting smoking. Okay. I hope it will be helpful for you. I wish you a healthy life. Okay. And take good care of yourself. Bye-bye.